close to us, Dr. Shanmuga Sundar. He's a DM FACE. Sir, the stage is all yours. And we already had a session on COVID-19, but you are going to tell us more about learning to minimize the risks for people with diabetes in COVID-19 pandemic.
Thank you, Dr. Sujoy. Good morning, everyone. Am I audible? Okay. Good morning, everyone. First of all, I thank Corona Remedies and Professor A.K. Das sir, and probably every internal medicine people or endocrinologists or diabetists have some association with A.K. Das sir. He was my examiner in the internal medicine. Thank you, sir. Thanks for giving me this opportunity. So without wasting my time, I will go into my topic. So learning to minimize risk for people with diabetes in the COVID-19 pandemic. There are few good talks in the ADA 2021 which address this one. So I will concentrate on main two talks given by Dr. Edward Gregg and Dr. Linda D. Meglu. So to start with, what Dr. Edward Gregg focus was interesting one. So we know that there are some relationship between the diabetes and the COVID-19 pandemic, but he showed some studies which addresses the indirect effects of pandemic in behavior of the people. So what happened is, due to the change in behavior, there are some risk factors are increasing which can lead to diabetes per se, that is new onset diabetes. So good things happened during pandemic is people started using home food, and they started taking vegetables and fruits. We all know that this happened with us also. But at the same time, what happened? Increase in snackings, increase in the meal frequency, and total amount of food consumed has increased. And even Western data says that there is 40% increase in the sweet intake. So if we have Indian data, definitely the numbers will be much more. So what happened due to this? There is again the increased risk of pre-diabetes or diabetes or hyperglycemia happened due to this COVID-19 pandemic due to this change behavior. And coming to physical activity also, he showed data that there is increase in the leisure time activity, but at the same time there is significant increase in the sedentary activity and also significant increase in the job related activity. So he quoted a data from JAMA also which showed that there is a 1.5 pounds increase in the weight per month during the lockdown. So almost 0.7 kg per month, which is a significant increase. So probably this factors may be contributing to the more increase in the diabetes or hyperglycemia during the COVID-19 infection also. So after that, he also focused on this, what is the link between diabetes and the severity of the COVID-19. So he showed data that almost 30 to 40% of the hospitalization due to COVID is due to diabetes. And among the diabetic patients, if we see the data, almost 20 to 43% of the people required intensive care, and case fatality rate is almost 25%. Dr. Arundhati Das Gupta already discussed that. So UK the data, the China data is almost 7% case fatality rate, and UK and US it's almost 20 to 25% case fatality rate. So he also discussed the same thing, and he also showed other data. So they compared the mortality rate of the diabetics due to diabetes during this pandemic compared to the previous year. So there is almost 50% increase in the mortality rate, and the mortality rate is also almost double compared to the general people mortality rate, which is again very significant. And the predictors for outcomes in diabetes, he told that the main predictors are the associated comorbid symptoms, conditions like CKD, coronary artery disease, heart failure, and the long duration of diabetes, concurrent obesity. Again, it's a very, very important risk factor for increasing the mortality. And also the acute and severe chronic hyperglycemia, if the HbA1c is persistently high, or new onset of again severe hyperglycemia may be contributing to increase in the severity of the COVID-19. So he concluded saying that we should consider population denominator also to assess what are the risk factors for this severity of the COVID-19. And also we should focus on this also, what this pandemic is doing to the alteration in the behavior, so that the people are at more risk for this obesity, diabetes, etc. in the future. So this is what we discussed. So next we'll go to the interesting talk. So this is a slightly different talk, but very interesting. So relationship between the type 1 diabetes and COVID-19. The Dr. Linda discussed this. She is from Indiana University. So she discussed on 2 or 3 important points. One is whether the type 1 diabetes are at risk for developing COVID-19. There is increase, whether there is increase risk for COVID-19 infection, and whether the mortality is increasing. And second interesting one, and whether COVID-19 is inducing type 1 diabetes or accelerating type 1 diabetes, And third is what are the indirect impact the COVID-19 is making in the type 1 diabetes. And to start with, she said the symptoms are similar to the general population with additional risk factor of developing severe hyperglycemia and decay in type 1 diabetes. Coming to the second thing, whether COVID-19 accelerates or induce type 1 diabetes. So if we see the pathogenesis of type 1 diabetes, it starts from a genetic risk, then there will be immune activation, immune response, and the patient goes through 4 stages. Stage 1 is normal hyperglycemia, where there will be a development of 1 or 2 antibody, and stage 2 will be abnormal blood glucose, and stage 3 will be the clinical diagnosis, and stage 4 is long-standing type 1 diabetes. Probably the COVID-19 can accelerate the immune activation, immune response, and stage 1 and stage 2. So the patient can be presenting with stage 3 earlier. So this is theoretically possible. And the initial reports also said that there is a link between the COVID-19 pandemic and the increase in the number of type 1 diabetes. But after that, various population-based study published in Diabetes Care 2020 by Randall and Tittle et al. Showed that there is no significant increase in the type 1 diabetes due to COVID per se, but they showed that there is increased chance of decay. Either it's a new onset type 1 diabetes or already established type 1 diabetes, probably due to the poor access to the healthcare. There is increase in the incidence of DKA, and probably due to the cytokine storm, probably there may be acceleration from stage 1, stage 2, stage 3. Stage 3 is where the clinical diagnosis is made. So probably the people already at risk for type 1 diabetes, the process is accelerated due to COVID-19 infection. And again, another one interesting data she showed from which has been published from Germany. So they analyzed antibody negative type 1 diabetes, the incidence of antibody negative type 1 diabetes during this COVID-19 2020 versus 2011 to 2019. So they showed data that type 1 antibody negative type 1 diabetes prevalence incidence is 6.6% during the 2020 during the COVID first wave, whereas previous 8 years it's almost 7.2. So 7.2%. So there is no significant increase in the antibody negative type 1 diabetes. Again, this data suggests less likely that type 1 diabetes is induced by the COVID-19. And Dr. Colin, who is the NIH director, also published and data showed that at present we don't have any evidences to say that COVID-19 per se induces type 1 diabetes. And coming to the mortality, so whether mortality is increased in type 1 diabetes, so there's some data from UK. So they analyzed 24,000 deaths due to COVID-19, out of which 8,000 is due to the type 2 diabetes. And in that data, the type 1 diabetes, the adjusted mortality rate is almost 2.9 times more in type 1 diabetes adults compared to the same age peer groups. But the main risk factor is age is more than 55. So they don't see the increase in the risk in the young type 1 diabetes. Probably the sample size is small, and the long duration of diabetes usually happens in adult, and vascular complications also more in the adults compared to the young type 1 diabetes. So these are the major contributor for this mortality. That is the long duration of diabetes and the vascular complication, which are less likely to be associated with the young type 1 diabetes. So data says that whatever data from various countries says that the mortality in type 1 adults is more compared to the peer groups or type 2 diabetes. But in young type 1 diabetes, the mortality is not increased. But one data from the UK showed that with young type 1 diabetes, if the control is not good, they may be having the prolonged course due to the illness due to the COVID-19 compared to the peer groups, but there is no increase in the mortality. Finally, she also showed that what are the indirect impact made to the type 1 diabetes due to the COVID-19. One is the increase in the incidence of DKA, probably due to the poor access to the healthcare, and also the psychosocial impact. Already they have the disease-related burden. Now the fear of access to the food and medicines are there. So and fear due to the COVID-19 is there. So the psychosocial factor can be associated there. So that also has to be taken care. So if you take all this consideration into consideration for the Indian people, so again we are at more risk. The type 1 diabetes at more risk because most of our type 1 diabetes during lockdown or during quarantine, the access to the healthcare and the access to the medicines may be a problem. So they are at risk for DKA. So we have to educate them So they educate the caretakers that proper glucose monitoring and ketone monitoring should be done so that the decay can be prevented. And finally, she said that one additional only good thing happened during this COVID-19 in type 1 again is the data from France. So they showed that due to the better exercise and better food pattern and adhering to the medicine properly, there is improvement in the blood glucose control in type 1 diabetes from the French data. So finally, she concluded that saying that we need longitudinal retrievable public data to analyze the difference between the type 1 diabetes and type 2 diabetes outcome due to COVID-19. And for managing type 1 diabetes, it should be a multidisciplinary approach. It's not only the glycemic control. So the mental aspect also be considered, and also the other difficulties what they may face during this quarantine or lockdown also should be addressed. And probably the telemedicine support should be made more strong so that the people can approach the doctors through telemedicine or the nearby community health worker, so that at least before landing up in any emergency, the problems can be tackled up. So finally, before ending my talk,
Doctor, can I request to wind up, please, because we have another speaker.
Yeah, fine. Just final talk is we know that. So finally, the most important thing is for diabetic population to minimize the risk is vaccination, and we have to follow the other things like social distancing, mask, and sanitizer. That's the most important thing, so that everyone knows. But the vaccination again has to be importance should be given, and all diabetics as much as possible should be vaccinated as early as possible. Thank you everyone for the patient listening.